Dr. Norman to tell you, and welcome. First off, thanks so much for showing interest in what we have to offer, and also most importantly, showing interest in your own, I'm assuming, pregnancy or children, parenting. What an exciting time for you and for your family. I want to impress upon you that the choices that you make throughout your pregnancy and throughout your parenting are so important to the children that you're going to bring into the planet. And even more than that, it is a really special time for the mom as well. Women have been giving birth since the beginning of time. There is nothing more natural, more safe than birth, truly. And for the most part, women have been giving birth without any outside intervention. And if you look back over the course of time, during that period, a lot of the complications that we're seeing today weren't there. So know that you have inside you everything you need for a remarkable pregnancy. It truly has the potential to be one of the highlights of your life, and such an important time for you, for your partner, and also for the baby as well. Now, we also hear this other side of birth as well, and there are plenty of stories out there where there's been tons of complications, there's been surgeries, there's been drugs, there's a lot of disconnection, fear, pain, all of this stuff that's going on. And yes, this is true as well. You know, that is potential that that things can kind of steer sideways. So what is the difference? Well, the difference is in the individual and how they care for themselves throughout pregnancy. Okay, know that the choices you're making throughout your pregnancy are going to make such a huge difference upon your birth. Okay, a couple of things to recognize. Number one, recognize that your body, your nervous system is talking to your uterus and also to your baby right from conception all the way through, meaning that your body is talking to the baby, telling the baby how to develop itself, how to grow, how to nourish itself. And it's telling it whether the world is a really scary place, whether it needs to grow up and be a fighter and fight to survive, or if it can come out into a safe environment and really thrive and access its full potential. The difference in that is how the mother is talking to the baby. So from the very early stages, your baby is programming itself. It's hardwiring both in its DNA and also in the neurology how it needs to develop itself for its upcoming life. Pretty astonishing. You also have tremendous potential of how you care for the alignment, the balance of your spine and nervous system. That's going to make a huge difference in the actual birth process. Research shows that for women who have an imbalance in the sacrum, in the pelvis, this area down here, it can reduce the pelvic outlet by up to 30%. That's a lot. I don't know a woman out there who would want 30% more greater opening during her pregnancy. On top of that as well, when there are imbalances in your spine and nervous system, one of the things that can happen is what's called a breech baby. For most of the life, the baby is going to be living, kind of moving side to side and living feet down. And then as the birth approaches, the baby knows full well to turn head first to prepare its descent. If there are restrictions, both in the pelvis and in the uterus, it can prevent the baby from doing what it naturally wants to do. So a couple of things to know. One is, with my approach, I use a very specific adjustment. It's a low force, completely safe. Most of the women who come in are like so relieved that chiropractic care can be as honoring and as natural as the approach that we do here. We work a lot with breath, with a mind-body connection, and you really are part of the process. So we're going to work as a team together. We've seen a lot of moms a later stage in their pregnancy who their babies are turned, and I know a really special technique is called the Webster in utero restraint release technique. And it's a very simple technique, and what it does is it helps to release the round ligament and the imbalances in the sacrum so that the baby can turn itself and drop naturally. We've had a lot of success with that, and the women who have been able to allow their babies to flip have been so grateful because it's been able to prevent C-section. Know that with every intervention, medical intervention that you take along your journey, it's going to increase the chances of further interventions. So meaning that as soon as we start to use outside force, the complications, the potential future complications start to rise. Would you want to do everything you can naturally to prevent that in the first place? Absolutely. And as I was mentioning before, not only are you preventing the bad stuff, but you're also going to help your baby thrive and really come out into the world being the best it can. A lot of our moms come in, when they're pregnant. Some even come before with the intention of conceiving in as healthy and balanced and alive body as possible. So wherever you are in your pregnancy, or if you have kids, we'd love to meet with you and see how we can support you. Okay, there are tons of options, natural approaches to really empower you both mentally, but also physically as well for this wonderful experience that you're about to go through. All right, on that note, if you're interested in finding more about our work, give our office a call, 250-740-0333. We'd be happy to answer any of your questions, if you have specific questions, and we'd also love to meet with you on a first visit. And on that first visit, we're going to do a very thorough physical, neurological stress profile as well to help us get to the underlying root issues. What are the imbalances? What are the core problems in your body that are preventing or impacting your pregnancy? Okay, it's very comprehensive. You'll learn a lot, I'll learn a lot, and then we move forward from there. All right, so on that note, I look forward to helping you out. Until next time, I'm Dr. Norman D'Attilio. Be well.